There's one or two paramedics in the back, and then there's the driver in the front who drives the ambulance.
I like to learn. Kids talk a lot.
We get things wrong sometimes, but we learn quick.
I'm Sophia. I'm Ethan.
I'm Riley. I'm Ricardo.
I'm Dr. Louis Kusa. I am an emergency department physician here at Trios Health. So, we're here in this room, and this is called a trauma room. Okay, this is one of the most important rooms of the emergency room. This is where the sickest of sick people come here. What kind of things do you think people come into this room for?
Like heart attacks or something?
Exactly, heart attacks, or if they were in a bad car accident.
Like serious broken bones.
They can, yes. I mean, sometimes we unfortunately see people who are shot. Sometimes we see people who are stabbed. Sometimes we have bad injuries, like that from car wrecks, where there are a lot of broken bones and a lot of different things going on.
When the people come in, what happens?
Well, if people come in by ambulance, they can be brought right from the ambulance. And we saw the gurneys or the beds that were in the back of the ambulance. They're brought right on that stretcher, right into here, and they're put on this bed. Then the nurses come in. They start to ask the people, the patients, what's wrong, what's the problem, how long they've been sick, and try to get some idea what's going on with them. And then they hook them up to some monitors. They'll hook them up to the heart monitor, for example, in here. Or they'll do vital signs, which is blood pressure and pulse and temperature, and they look at how well they're breathing and how much oxygen is in their blood. And then they start to do the things that are necessary to help take care of them. But after the nurse gets all that started, the doctor comes in also, and the doctor will talk to the patient and examine the patient and decides what type of things need to be done. And then he can tell the nurses what to do and what sort of things the patient needs. We can do anything in rooms like this, but that's kind of the order of things. They come in, they get signed in, the nurse checks them, the doctor checks them, and then we start taking care of them and doing the things that we need to do to make them better.
How many patients do you see per day?
It can vary because there's no appointments here. People just come when they're heard, or the ambulances come when they're called. But we can see anywhere up to 110 or 115 people a day. Yeah.
Are there any emergencies that you cannot fix?
When people are hurt terribly bad, we'll do everything we can to take care of them and to stabilize them and to get them the care that they need. But there are some times when people are hurt worse than we're able to help. And no matter how many specialists we bring in and no matter how many people we come to try to help that person, sometimes people are hurt beyond the point of being able to help them. And unfortunately, sometimes they die. And that's a hard thing to do in the emergency room, but it's something that happens. Fortunately, not very often, but nonetheless it happens. If they're badly hurt, that can happen.
Is it scary at all?
To work in the emergency room?
Yes.
It can be. It can be scary. There are sometimes, the police bring people in sometimes too, and some of those people can be scary. There are people who come in who are taking drugs and things, and they're not acting quite right, and that can be kind of scary too sometimes. So we have to kind of be careful. But we have a lot of help here. We have people here in the hospital who are well trained. The police will often come and help us, and we have people who are angry and who we can't control very well, and they'll come and help us do that until we can get control of the situation so we can help them better. But it can be scary sometimes.
What do you do to make it less scary for a patient?
Well, we talk with them. We try to relax them. Sometimes we give them medicines to help calm them down and relax them a little bit when they're really scary. But we just let them know we're here to help them and we're going to take good care of them. And many times people just being here feel better just because they know that they're going to be well cared for.
How many kinds of rooms do you have here?
Well, we have 2 of these type of trauma rooms, okay, and these are the biggest rooms. These are the rooms where we take care of the sickest people, like I told you. But then we also have 12 other rooms, okay, not as big as this, but we take care of, in those rooms, anything. People who have sore throats or earaches. We take care of people who have broken bones or sprained ankles. We take care of people who have cuts and bruises. and we do those types of things here as well.
Are you gonna have any new ER at the hospital?
You know, we are. In the next 3 months or so, we're going to be moving to a brand new hospital. I told you we had 14 beds, these two plus 12 others. In the new ER, we're going to have 28 beds. So we're going to have a lot bigger emergency room. We're going to have a lot fancier equipment, and we're going to have a lot more room to take care of more people who are hurt. So we're excited about that and really looking forward to having, you know, a new emergency department.
Does every hospital have an ER?
You know, every hospital does have ERs, and I think it's really important to come to a hospital that, you know, to an ER that is in a hospital, because if people need to go to surgery or they need to have some of the special care that we talked about that the cardiologists do in the heart cath lab, if they need those special things, then we can get them immediately there. If they go to an ER that doesn't have, that's not in a hospital, then they have to get back in the ambulance, they have to be taken somewhere else.
What's the most important thing that a kid needs to know about the emergency room?
Well, that we're always here, 24 hours a day, every day of the week. We're always here to take care of people who are hurt. We've got wonderful people here who are well trained, who are specializing in taking care of emergency patients, and we're gonna make you all better as best we can. Well, it's been great to meet each of you. I think that looking ahead at your futures, I mean, medicine is a great thing. Emergency medicine is a great thing. But it's been a real pleasure having you here and answering your questions and getting to know you a little bit. That's been a lot of fun for me.
Thank you, Tim. Thank you.
You're welcome, all of you. Hope you come back, but not as a patient. Okay, come back and visit, but don't come as a patient.